I had 14 courses over the last 10 months. Some people might be curious of what grades that I got. I will share that right now. Hi guys, what's up? Welcome back to my channel. If you are new here, what's going on? My name is Marissa. I make college, lifestyle, and the occasional nursing video. And today I'm going to be talking all about different classes in nursing school. If you guys are new here, I just graduated from a LPN program. So I'm basically going to go through every single one of my classes that I had this past program and go through basically the difficulty, what I would give advice on, and like basically the main components of it. So if you are going into nursing school, you even have considered nursing school, or you're currently in it and you are like, how bad is pharm going to be? This is the video for you. I always respond to every comment, so if you have questions about these classes, this is also going to be a new series on my channel, which I'm very excited about. It's basically what you need to know before nursing school, during nursing school, that type of thing. This topic is going to be about classes. It's going to be about what you physically need, clinical prep, all of that type of stuff. Leave other topics that you want to be discussed down below and I will do them. Give this video a thumbs up if you like it, because then I will do more in the series. I have it all typed out on my laptop right here, so I'm just going to be referring back to this. I wrote them all down and I'm rating them through a 1 through 5 of difficulty. 1 being very easy, didn't really stress or didn't really study that much. 5 being the most difficult class I've ever taken and I never want to take it again. My program did have anatomy and physiology and microbiology into it because it was kind of a standalone program. It wasn't like you had to do a bunch of prereqs and then get into it. You had to pass T's and all that stuff, but it is a little different. I am going to just quickly go over those just because they are pre-nursing. So if you're pre-nursing, these are for you. Anatomy, basically it's just basic memorization. If you're in nursing school, you know that. You also do need to actually know it because then you're going to use it in your concepts, in your med surg and all that stuff. So you need to know where everything in the body is, obviously. I rated this a 2 out of 5 because I've taken this class 3 times in high school and college. Now in this course, it was super easy for me just because memorization is pretty easy. I have different tricks and mnemonics to memorize everything, so that was that. Microbiology, this was the first time that I've actually taken it. I didn't take it in college yet. Keyword yet. I am doing an RN program hopefully soon, so I will have to do that. I also rated it a 2 out of 5. I thought it was pretty easy. It's basically another bio class, which if you have already taken bio, basically 101 and 102, this won't be that difficult. We did focus a lot on infectious diseases in this class. We had a project of, mine was actually measles, and we did of as a nurse, what you would do for that patient with that disease. So other students all presented them, so now I know what to do for all these range of diseases, for nursing interventions, diagnoses, that type of stuff. So this does touch on lab values, which you need to know lab values. Trust me, I'm currently studying for the NCLEX. You need to know lab values. Next, nutrition. So I rated this a 3 out of 5. It's a lot of chemistry based, which I'm not a fan of. I had to retake my Chem 106, I think, and I kind of didn't like it. It is very important to know what your patients need for nutrition, especially with certain diseases like, say, osteoporosis or something like that. You need to know what their diet is going to consist of and the values that they should have in their body that correlate with their diet. So it is important, but I didn't really like it. It was medium difficulty. So I also took Pharm 1, 2, and 3 in this program. It's basic memorization and knowing the classes and the profile drugs and everything. That medication is a huge part of nursing. It's just a difficult class. So I rated this a 4.5 out of 5. Profile drugs, know your profile drugs. Always better to know your generic drugs rather than your brand drugs, because the NCLEX tests in the United States and Canada. So you need to know the generic because there are going to be different brands in different countries. So if you want to pass the NCLEX, you need to know the generic. In clinical, I basically said in clinical, you're going to see a bunch of different drugs and write them down. You obviously are going to look them up before you pass them, but make an extra list of associated drugs. So you also know the side effects of those two and when in the day you can give them, what you shouldn't be eating with certain medications, and also know how the drug works. So that's very important. So whether it's a beta blocker or a calcium channel blocker, that's hypertension, you need to know how it works, because then you'll know how it affects the patient. Human growth and development. So I rated this a 1 out of 5. I thought it was so easy, and I also love this stuff because it's like child growth and development. If you've taken that in college, I took that last year when I was a sophomore. It's from like basically the birth to death process. If you've gone through your bios and your psychs, it's not really that difficult. The only things that I've seen past this class, like onto like NCLEX review, would be Maslow and Erikson's theories, like Maslow's hierarchy of needs. Not much has been taken from that because it's built on in say pediatrics or maternal newborn, because it's like beginning of life type stuff. Fundamentals. I loved fundamentals. I rated this a 3 out of 5 for difficulty. It came to me a lot easier than I thought it was going to, which was kind of like, okay. First like real nursing class. This is where you're getting all the concepts. All the questions are phrased like NCLEX style, not fact-based. Like anatomy and fundamentals are so different on tests. Anatomy, it's like, okay, what's the answer? And this one's like, what's the most right answer? Select all that apply, and maybe you'll get it right. It's very to like, okay, here's the patient situation. What are you gonna do first in this situation? How are you gonna care for the patient best in this situation out of the 5 or 4 options? And lastly, for this term, we had nursing care of the well older adults, so basically geriatrics. I rated this a 4 out of 5. I expected it to be easier because I was like, oh, it's just like basically the same care as fundamentals. Wrong, it's really not. Caring for an older adult is a lot different for caring for like a middle-aged adult due to, say, like, I'm just gonna give an example. If an older adult has a UTI, their first sign might be that they have mental confusion, not that anything in their urinary system is actually like presenting with a problem. Sometimes it feels like the answers are the opposite of what you would think they are, because if they throw an older adult, you gotta be like, okay, let me really think through this question because it could be completely different than what I thought it would be. Second semester, I did take Pharm again, Pharm 2, kind of the same thing. We just kind of like progressed through a different class. Concepts of nursing. So this was our med-surg clinical unit as well. So med-surg and rehab. So this was getting into pain management, pre and post-op surgeries, rehab, this wound changes, this is different procedures, catheterizations, that type of stuff, and I loved it. I thought it was awesome. I love med-surg. Basically building on what you learned in fundamentals. Obviously safety and all that stuff is very important, but that's highly stressed in fundamentals, where in concepts you're more focusing on the actual procedures that you're doing, the complications of them. I said 2.5 out of 5 because it came to be pretty easy, but it could be completely different for you, and it was different for a lot of my classmates as well. Nursing trends, I rated a 1 out of 5. This was our last class for our second semester, and it was pretty easy. We learned about the history, Florence Nightingale, the background is nursing as a profession. It was more like a history class rather than like a nursing class, so I found it very easy, and it was almost like, oh my gosh, I'm back in high school. Like this is pretty easy. Moving on to third term, which got cut short due to Miss Rona. Maternal newborn, I would rate like a 5 out of 5, and I'm not kidding. Been to teaching ourselves in remote learning, but wow, is that difficult. There was so much information. Just the pregnancy itself, so much can go wrong. The delivery, so much can go wrong. You need to know what is supposed to go right and then what's gonna go wrong, and then fix or try and help fix what's going wrong when it is going wrong, if that makes sense. Not only is the mother your patient, also the infant, and there's pre and postpartum care and during the delivery, and it is definitely something that I'm actually going to see again in my RN programs. We also were not able to do clinical because of Miss Rona, so I think seeing it in clinical and then applying it in class would have helped a lot more, because in med-surg and concepts, I was seeing everything that I was doing. I learned about catheterization, I did it a week later. We only were able to do like online sim labs. Family centered, which is basically pediatrics. I loved it. It was difficulty 4 out of 5 though. It was hard, but I just simply loved it. And it's a lot of actually parent teaching and also trying to anticipate how a child is gonna react to a certain procedure, even as simple as like a flu shot, or like how to care for certain age groups. Pediatric medication is very, very different than adult medication. Everything is weight-based for children, which obviously it should be. So it is difficult to just get a grasp on that and be able to do those calculations confidently. So we had to do a competency test as well. Advanced Concepts of Nursing was the second like med-surg type for this class. I rated it a 2 out of 5. I thought it was pretty easy based on the knowledge, where it was just kind of continuing from med-surg. It was just basically more in depth, a general type of nursing that was applied to multiple different areas or facilities that you could be in. And our last class, which was actually the last class that we finished up about a couple weeks ago, leadership and management, 1 out of 5. Basic work environment skills, managerial skills, when to delegate, when to not delegate, what nurse should be doing what, like the RN, the charge nurse, the aide, the LPN, the student nurse, basically when to delegate, how to take doctor's orders over the phone, that type of stuff. Also, which I thought was really helpful in this class, was how to make a resume, how to apply to jobs, and how to interview for jobs, because I've had jobs, but I've never had a job as a nurse. So they're gonna ask you more specific questions than, like, I worked at a hospital last summer in medical records. They didn't really ask that many questions. Where going in to be a nurse, they're gonna ask you a lot of questions about your experience, what you're comfortable with, give you maybe a couple situations. So this was very helpful of like making your resume. We had to submit it, and then our professors critiqued it and basically were like, include this, don't include that type of stuff. This class was very helpful for just like getting the loose ends at the end of the year together and making sure we're good to go off into the real world and to apply for a license, apply to jobs and everything like that. I had 14 courses over the last 10 months. This was a very accelerated program, but the classes are generally going to be the same across all programs of like what you're generally learning. With my grades, some people might be curious of what grades that I got. I will share that right now. My lowest grade was an 82. And my highest grade, 93. So, and that was in nutrition. And my lowest grade, the 82, was pharmacology. Are we surprised? I'm not. Thank you guys so much for watching this week's video. I really appreciate it. Like I said, make sure to comment down below. Give this video a thumbs up. Make sure to subscribe. We're growing so quickly, which I really appreciate. And let me know if you have any questions about college, nursing school, basically anything in general. Make sure to follow me on Instagram to see my graduation pictures. I think they're awesome. Thank you guys so much for watching, and I will see you in my next video.